They let me in. All right. Good morning, everybody. Can you all hear me? Just making
Yes.
sure.
Yes.
Okay. How are you all doing today?
Doing well. How about you?
I'm good.
We can't see you.
Yes, 1 second.
Okay.
Okay, now that everybody's here, I think we should get started. So hello, everybody. Welcome to the impact of COVID-19 on toxic relationships. My name is Nawaal Nizam. I am a workforce development specialist with Detroit Wayne Integrated Health Network. So we are going to start off with an introduction of all our panelists. Today we have here, 1 second, sorry about that.
Uh-oh.
I'm sorry, can you all hear me? Hello, are you all able to hear me? Okay, thank you. Just making sure because my internet wasn't working earlier and I just want to make sure everyone can hear and see me properly. Okay, so sorry about that. So today we're going to be talking on the impact of COVID-19 and toxic relationships. On our panel today, we have Stacey Johnson, who is an executive director of Stacey J Productions. Pamela Morgan with Key Insights, who is an owner, trainer, and therapist, pastor, and minister of Kingdom Keys Apostolic, and Natalie Cote, who works with us at Detroit Wayne Integrated Health Network as a mentor, intern, and also works with Wayne State University, I believe. So we're going to start off today with a little public service announcement on Human Trafficking from Stacey J Productions.
Stacey, you're muted.
Second, because it's just slightly different what we've done before, but I'm going to put the YouTube link in real quick. So just give me a second.
Do let me know if you need help. I do believe I have the link on hand as well.
Okay, and if you could present the link, that would be great.
Okay.
Thank you.
Let me pull it up here.
Okay.
Is the link not on YouTube?
Okay. Let me mute.
I want a pizza. I want a pepperoni pizza with cheese. Matter of fact, I want extra cheese and I want the pizza to be large.
Hi, I got it nailed down between 1 and 2. And I think I'm going to go with 1. Yeah, I like that.
Thank you so much, Stacey, for that.
You're welcome.
Very
Thank
insightful video.
Thank you. I don't know how to remove that other part of the screen. I don't know if you see there's another screen up there, but is that, let's see.
Do you see my screen now?
I do. Okay. Okay, I'm gonna leave and come back in just to kind of refresh everything for me.
Okay.
Okay.
All right, so today's discussion is going to be on the effect of COVID-19 on toxic relationships. And like we saw that video from Stacey Productions, human trafficking is also a big part of toxic relationships, and we will also be discussing that further in the presentation as well. So first off, what is a toxic relationship? So I want to pose this question to all of you, and I want to ask you, how do you define a toxic relationship? For you, is it physical abuse, emotional abuse, sexual abuse, neglect, or all of the above? There's a QR code where you can submit your answer. You could also submit your answer on www.poll.si with the poll ID. I'm going to enter that in the chat for everyone who has difficulty scanning the QR code. You could also put your answers in the chat if you feel more comfortable doing so. I do see a lot of answers coming in, and typically all of you are saying all of the above, and all of you are right. It is all of the above. So what are the aspects of toxic relationships? Like most of you identified, it composes of physical abuse, emotional abuse, sexual abuse, as well as neglect. What is physical abuse? Well, this involves physical harm or injury to the individual. It could be the result of a deliberate attempt to hurt the person or excessive physical punishment. Now, we talk about physical punishment because many physically abusive parents may insist that their actions were simply forms of discipline, ways to make their children behave. However, it is important to note that there is a big difference between using physical punishment to discipline and physical abuse. It sometimes can be a very tricky line, but it's important to note when an individual is using a physical punishment and how often they're using and what kind of effect it leaves on perhaps the child or individual. Next, we have emotional abuse. Contrary to some people's beliefs, words can very much hurt, and emotional abuse can severely damage a person's mental health or social development. Emotional abuse can include belittling, humiliating, name-calling, shaming, yelling, threatening, bullying, and telling someone they're worthless or no good, ignoring or rejecting a person for no reason, or exposing the person to violence. Next, there is sexual abuse. Youth sexual abuse is an especially complicated form of abuse because of the many layers of guilt and shame it comes with. It is important to recognize that sexual abuse doesn't always involve body contact. And I want to emphasize this, that sexual abuse doesn't always involve body contact. It can also be being exposed to sexual situations or material that is sexually abusive, whether or not touching is involved. It's typically up to the victim of what they feel that their boundaries are being crossed and how uncomfortable they are in a situation where they may feel that they are being sexually abused. It's always great to always know your boundaries and your limitations with it, and know that if you feel uncomfortable in a situation, to kind of distance yourself before it can lead to sexual abuse. Next, there's neglect, which is the most common type of child abuse and not always easy to spot. Neglect is a pattern of failing to provide for basic needs, which includes adequate food, clothing, hygiene, or even supervision. In many cases, and sometimes an adult might be physically or mentally unable to care for a child or another individual, such as in cases of serious illness or injury, or untreated depression or anxiety, or even substance abuse disorders. So what are the long-term effects of abuse? Well, there's a huge lack of trust, because if you can't trust your friends, family, or your parents, well, who can you trust? Without this basis, it's difficult to learn to trust people around us and know who is trustworthy. This can lead to a difficulty maintaining relationships in adulthood. It can also lead to more toxic and unhealthy relationships because the adult does not know what a good relationship is. Next, it can lead to self-image issues. If you have been told over and over again that you are stupid or no good, it is very difficult to overcome such core feelings. Many abused youth may neglect their education or settle for low-paying jobs because they don't believe they are worth more. Many sexual abuse survivors with the stigma and shame surrounding the abuse often struggle more with the feeling of being damaged, which can worsen with addressing the issue. Next, there can be many emotional issues that come with the long-term effects of abuse. Abused youth typically cannot express emotions safely. As a result, the emotions get stuffed down, coming out in a multitude of unexpected ways. Adult survivors of abuse can struggle with unexplained anxiety, depression, or even anger. This is dangerous because the individual can then turn to alcohol or drugs to numb out the painful feelings. As you can see, there is a multitude of issues that comes with abuse relating to the self. It can be very long-term and damaging to your brain and to your mental and thereby physical well-being. Well, where can toxic relationships be found? It is very, very common in dating abuse. Roughly 1.5 million high school boys and girls in the US admit to being intentionally hit or physically harmed in the last year by someone that they are romantically involved with. 33% of adults in America are victim to sexual, physical, verbal, or even emotional dating abuse. Teens who suffer dating abuse are subject to long-term consequences such as alcoholism, eating disorders, thoughts of suicide, and violent behavior, as well as are more likely to contract STDs. Females between the ages of 16 and 24 are 3 times more likely than the rest of the population to be abused by an intimate partner. Next, you can see toxic relationships and human trafficking. Many young women and men are reported as being more exposed to violence, sexual abuse, and exploitation during the COVID-19 pandemic. As governments divert their assets to mitigating the spread of COVID-19, human traffickers are emboldened to exploit a new increase in potential victims and vulnerable populations, with slower responses from law enforcement. Trafficking can occur to adults and minors in rural, suburban, or urban communities across the country. Victims of human trafficking have a diverse socioeconomic background, varied levels of education, and may be documented or undocumented. Essentially, what this means is that anybody and everybody is susceptible to human trafficking. There may be populations where it happens more and less in, but essentially, it cuts across every single diverse background. So how can we avoid human trafficking? Well, it's very, very important to be aware of recruiting tactics. Traffickers target victims through social media websites, telephone chat lines, after-school programs, at shopping malls and bus depots, in clubs, or through friends and acquaintances. It is therefore important to ask questions to new friends, especially friends who appear to be significantly older. Traffickers can also be part of your family member or even your peers. Essentially, be suspicious of literally everybody, even when you are with friends, because traffickers can spot you in large crowds as well as empty parking lots and gas stations. It's always good to be aware of your surroundings, especially when you are alone and have are suspect to possibly many issues. Human trafficking can literally hit you anywhere, and it's just good to be cautious and just aware of your surroundings, and I cannot emphasize that enough. So if you or anyone you know is possibly being trafficked, it's always important to call the National Human Trafficking Hotline, where the number and SMS text are below. You can even call in this if you think that possibly someone is being trafficked or is susceptible or having or possibly in a relationship where they might be trafficked. It's always good just to possibly send them that number or even call it yourself. So how does social media play a role? Well, many of you who are on TikTok may have heard of the Randonautica app that became extremely popular. So essentially what this app does, it sends randonauts, which are people, are players of the game, to places that are seemingly deserted and sets them up for a possibly dangerous situation, but it claims that it's setting them up for an adventure or finding something fun. Social media has created a culture essentially in which people pursue trends for attention and recognition. This trend is no different from another, except it has viciously targeted a group of young adults who are vulnerable to a variety of attacks. Over the course of time, as technology has become more adaptable, it has become easier for perpetrators to manipulate phone applications and social media to lure young adults and children. Especially in the United States, human trafficking is notoriously underreported, indicating that this activity is not only operating in distant sphere of the world, but in our local communities as well. This additionally poses another concern regarding the security of this app and how it may be used as a tool to enable such situations. Basically, I do want to point out that this app, the Randonautica app, became popular on TikTok because it sent out a group of kids to a random location where they found a suitcase of human remains, of body parts, and it was creepy, and they had to call the police and the FBI. And essentially, this app sends you out to seek an adventure, and you don't know what you are going, where you are going, or what is happening around you. These apps can be easily manipulated, and doing something just because it is a trend is not always the best idea because you don't know what you're getting yourself involved in. These apps and things like these on such platforms like even TikTok can possibly set you out for a very dangerous situation and can lead to situations like human trafficking. So what is specifically the effect of COVID on toxic relationships? Currently, many victims are trapped at home and they were spending increased time with their abuser. COVID-19 has led to many people being isolated, which can cause the abuser to take advantage of the situation. It can also cause a victim to face further abuse. Many victims currently fear going to hospitals for help because they don't want to be questioned about their abuser. People are currently under a ton amount of stress, mainly financial. This increases frustration as well as tension, and also increases susceptibility to human trafficking, as we discussed. Social distancing is also proving challenging for people to attend assistance and advocacy programs. It is crucial to understand that 911 is not the only resource available. There are many ways you can reach out for help. Like I said, there is the human trafficking hotline, as well as other resources that I will go over that you can reach out to for help if you or anyone else that you know is possibly in a toxic relationship at all. You can definitely send out that share those resources that I will go over soon. Next, I want to share this music video by Whitney Houston. Bear with me for a second here while I pull it up, please.
Well, there's a bridge
I was also made aware actually recently that she suffered from substance abuse issues. And I think that song is very inspirational coming from someone who had um, an addiction like that, that it is something that you can overcome. There are many issues that you can overcome step by step. There are many resources out there now too that um, you can utilize to help you with this journey or whatever you are facing, or a family member or a loved one or anyone around you is facing, that there's always a way to overcome. And it's an uplifting song. So I just like that. Let me just pull up my slides here again. So, speaking of steps, coping with abuse. How can you do it? Well, it's important to develop healthy routines before bedtime or in the morning. Coping with abuse, you feel a little uncertainty in your life. You feel a little hopeless. Well, developing healthy routines can make you feel a little bit better about yourself or your day. Healthy routines can include small things like stretching, taking a shower, drinking coffee or water, exercising, making a to-do list for the day, or even small tasks like washing your face or making your bed in the morning. They're just important little things just to check, like do by yourself, check in on yourself. Little routines that make you feel a little bit more normal. Make a list of things that you are thankful for or happy about. Always counting your blessings helps you feel better. Practice focused breathing. Find a safe space. Take deep breaths in and out, and help yourself to calm down and just release any negative energy that you may feel inside of you. It's also very important to seek guidance from a professional. The National Domestic Violence Hotline also provides 24/7 support for anyone who is facing any sort of abuse, and can be reached at 1-800-799-7233. Detroit Women Integrated Health Network also provides mental health services and can be reached at dwin.org, or you can also call our 24/7 helpline at 1-800-241-4949. If you are looking for guidance from a professional, Detroit Women Integrated Health Network can also help you set you up with a provider or someone who can help you get that professional advice. There are also a bunch of other resources, and as well as 24/7 helplines by county that you can easily search up and call if you're ever feeling any certain type of way, want to talk through your emotions. You don't need to technically be always dealing with abuse. It could be internal to or mental health issues that you could call Detroit Women Integrated Health Network for. It can help you with anything that you are going through mentally and interpersonally. So I want to talk about a different type of toxic relationship. There's cancel culture, especially in relation to social media being huge these days. So I have a question for all of you all. How many of you have heard of cancel culture or seen it take place in your very own social circles or on social media? Once again, I have a QR code for you all. You guys can all go on www.poll, that's POLL.SI, and submit your answer on that too. The poll ID is ONHQ. I'm going to put that in the chat for anyone who needs it.
Excuse me.
Yes.
This is Cara Thomas, and I wanted to interject just a moment here. A couple of things for your polls. We would like for those to be used in the polls in the actual system so that we can capture them as well. I also wanted to make sure, I'm not sure how much more time you were going to be presenting, but we would like to allow our three presenters here to be able to answer some questions and to speak because the time is only about 15-20 minutes left in this session. And so I wanted to be respectful and interrupt for just a moment. to allow them to be able to share.
Okay.
Thank you.
Okay, so we have a little bit of a slideshow left before we can open up the floor to more questions. So let's just finish up the slideshow really quickly. And I see here that 77% of you have seen or heard of cancel culture, 15% are not sure, and 8% said no. So what is cancel culture? Well, cancel culture involves calling someone out for doing something that is regarded as typically wrong and not allowing room for apology or forgiveness. Especially in high school, these snap judgments people make about each other can spread, and in extreme cases,
What I'm
lead
gonna
to
say-
large-scale canceling that has now become infamous.
Excuse me. I know we're doing technical in the background here. Excuse me one more time, ladies. I do apologize. I do want to ask if you have been able to give introduction for each person before I disconnected earlier. Hopefully they have had a chance to be able to be introduced as well. And if you could share the outcomes of the results of the polls in your chat as well. I know I'm taking up some time, but we have to allow for the two speakers to come on as well. Thank you.
Okay. Well,
So finishing up here a little bit, cancel culture can be used to bully others for things that they said or did years ago, an experience that they may have learned or grown from. A lot of what cancel culture is basically, especially on social media, pulling up old receipts of what people have done or said in the past and basically saying, okay, we're not going to follow you anymore, or we're not going to listen to you anymore or be friends with you anymore. It's a way of basically canceling that person and saying that they were wrong and they are still wrong, even though that they said something or did something a while back. So what's important how can we fix cancel culture? Well, the first step to fixing cancel culture is to make sure that we all have a clear sense of what's going on around us interpersonally. It is also important to understand that although things posted on the internet and social media are permanent at times, that people make mistakes. To err is to human and it is normal. What matters more than our mistakes is if we apologize and understand what we did or said was wrong. For this, I'd really like to give the example of early COVID last year when BLM was a huge thing, and it still is, most definitely is. And a lot of people were being canceled for saying the N-word without realizing the racist and historical context of the word and how the meaning behind the word and how offensive it is to say that word. Many people were being canceled for saying that word or having said that word. If in such
Ladies, we'd like to hear from you as well. Can you share your experience when it comes to toxic relationships, especially at the time of COVID, with the audience? Stacey, do you want to go first?
Okay, I think you said I want to go first, right?
Yeah, would you like to share a couple of comments? We only have a few minutes left.
You know what? I will yield to these wonderful ladies who've been patient. I will yield to them. And so I am going to remain mute because they've waited patiently and I do want to hear what they have to say. God bless y'all. I'm still on. If
Okay.
anybody has a question or
Ms. Pamela Morgan, would you like to share as far as anything in regards to toxic relationships during COVID and what your experiences have been?
Absolutely. You know, a toxic relationship is a relationship that ultimately makes one sick, either physically, mentally, or spiritually. And toxins, when we talk about toxins, we're talking about in the natural sense of it, poisonous substances that produce activities in our bodies that cause us to become unstable. And so when we talk about toxins emotionally and toxins spiritually, and this is a faith-based conference, when we talk about toxins spiritually and emotionally, we're talking about toxicity, the state or the quality or the relative degree of being poisonous in our emotions and in our spirit. And so when COVID hit, any toxins that were there, even lying dormant, surfaced because we were all thrown off our kilter. We were all shaken and pushed into a place that we had not experienced before, that we had never seen before. In fact, our spiritual or our emotional metabolism was not operating correctly. When we think about metabolism, we're thinking about the process by which we handle physically in our physical body. For instance, we handle sugar, we metabolize it. And so when were thrown into COVID and knocked off our keel, we began to try to handle this new environment, this new situation, and we were challenged, we were struggled, and so we may not have handled it in a healthy manner. There are a few toxic signs of toxins in relationships that emerged, especially during COVID. One is that relationships may have escalated faster than normal because of isolation, people getting together after a short period of time and being unable to leave an unhealthy situation or abusive situation because of quarantine. But some of the other things that happen, you know, when I think of a toxic relationship, I think of the toxins causing such a disturbance in the emotions that we become thirsty. We become so thirsty. And when one is thirsty, I often ask this question when people tell me how in love they are. Is it love or are you just thirsty? Because when we're thirsty, I see you laughing, Stacey. When we're thirsty, we become dehydrated if our thirst is not addressed. How many times have you been dehydrated and had to go to emergency because you needed an IV? And so when we look at emotional and spiritual thirst, and this is a faith-based conference, and so we've got to talk about the need for living water. We've got to talk about that emptiness and that thirst and that dehydrated state that when it's not met with living water that's able to go deep and go in and find our issues, our loneliness, our abandonment issues, our anxiety issues. And there was a high level of anxiety during COVID. At the onset of COVID, because COVID ain't gone, but at the onset of COVID, there was anxiety, there was fear, so many emotions emerged. And so back to being dehydrated, in that dehydrated state, we began to see who and what we think we need instead of seeing who and what is really there. And so I believe that what happened for many of us is that the toxins rose to a high level. you know, and we begin to make choices out of that toxic state, out of that dehydrated state, thinking that we were choosing what was best. And in essence, we were choosing what we thought we saw and not what was really there. And so, you know, when you think about a dehydrated state, nothing can satisfy that but IV. And so we, the people, as human beings, we need an IV of living water to go deep inside and deal with issues. You know, we were talking about human trafficking. And there are 3 T's of human trafficking, that 3 T's of victimization: being targeted, being tricked, and being traumatized. And these are useful to the predators because of toxins in the emotions, because of the emptiness, because of the dehydrated state, because of anxieties, and because for our adolescents especially, because of unmet basic needs. They're on the street, they're needy, they're unstable, they don't have those 5 tiers that are talked about in Maslow's hierarchy of needs: the physiological, the safety, the love and belonging. These things are missing. So there's a void and an emptiness. You know, when I was introduced, one thing was not mentioned about me, and that is I'm 30 years in recovery from a crack cocaine and alcohol addiction. And one of the first things I had to deal with, or I was going to end up back trying to fill that void with drugs, was my inability to fill the void and trying to fill it with relationships because of the toxic state in my emotions, because of so much that was missing growing up. And so again, this is a faith-based conference. I want to talk about how God will pour out his spirit and living water on those that are thirsty. Listen, a sponge will soak up what's poured into it. But if the sponge is already full of a whole lot of other stuff, there's no room for anything else. And so that empty state really is not a bad place to be if you understand that the only thing that will satisfy a dehydrated, thirsty state is true and living water, the truth. And that's what saved me out of the madness that I was in, was that I shifted from coming from a drug addicted lifestyle to realizing that if I didn't get more than just existing and just abstaining from the drugs, if I didn't stop trying to replace the drugs with a person or people, I was going to end up in a worse state than I was. And it was God that brought me out of where I was and brought me into a place of knowing that I needed him to pour into me true and living water. So I just wanted to share that some of what we see as far as the manipulation that has taken place during COVID, when using sheltering in place as an excuse or to prevent someone from leaving a location, to control someone, manipulation, sabotaging, withholding or purposefully using limited resources like medical supplies, food, Wi-Fi, transportation, or money, purposely withholding those things from someone to sabotage their success or to sabotage their achievements, guilting, making someone feel bad for having conversations about having boundaries in this shared space. We're sheltering in space, in place, and so we need our space for our own mental health. And so guilting can be one of those things as well. Using the current situation as an excuse for unhealthy behaviors, like yelling and going off on somebody and then blaming it on COVID. And I'm so stressed out, but not using any coping skills. Those toxicities rose to the top when COVID hit. We found out what was in us that we thought was gone. If there was anything lurking, If there was any underlying issues that we thought we had dealt with, COVID brought it all to the surface. And I want to say this, when we talk about toxins, and this is a faith-based conference, when we talk about toxins, we've got to talk about the inability to process what was going on, that damaged metabolism. We've got to talk about that, not just in the family, not just in the family, but in the workplace and in the religious community, because a lot of toxins surfaced in the workplace and in the religious community. And I yield the floor.
That was excellent, Ms. Morgan. Thank you so much for sharing your experience and also your knowledge on this issue. I would just pretty much reiterate everything that you said, and also add that although I am in a healthy relationship where I'm married now, I've been in toxic relationships life, and I'm what they describe as a serial monogamous who kind of jumps from relationship to relationships, just kind of to fill that own toxic void I had in myself. And I would bring up the point of that if sometimes people who get into toxic relationships have issues with codependency, and that's something that needs to be addressed, ideally in therapy or at least with your support system before you're really ready for a healthy relationship. And one question I wanted to kind of pose to our viewers was whether you thought a toxic relationship could possibly be transformed into a healthy one. And if so, what would be required for that to be done? Because, in fact, because of COVID and the stay-in-place restrictions and mandates, a lot of us are in relationships where they may be toxic, but perhaps they may be salvageable. And if so, what would be required to make that the case? Or if a relationship has always been toxic, will it always be toxic? Sources I found on this instructs that you ought to go to couples therapy and determine whether the relationship is salvageable or not, and then go from there and have that be determined by a therapist. But yeah, that's basically all I had to share. Thank you guys so much.
Well, all right, Miss Stacey, you gonna share with us?
Thank you so much. I know my purpose was to come on and speak about human trafficking, and I think that the speakers have done an incredible job. This is what I do all the time, but it's so good to hear some different perspectives. I learned a lot about the round of something app. I have it written down in my notes, but that's some information that I will research and share in my conferences. But Natalie Cote and Minister Pamela Morgan knocked it out the park. And I have to add, I'm gonna add this as well to my trafficking in my trafficking presentations: targeted, tricked, and traumatized. And that right there is definitely what pimps seek out. That's what they do. They target, trick, and traumatize, and at malls and train stations and bus stations and different things like that. I am a retired police officer, and I am also I'm a sexual abuse survivor. And what Pamela talked about, when we don't get things or things happen and we don't deal with that trauma and how it manifests, and COVID did bring out a lot of things in people and how things manifest. And so it's so important that we get help. And more importantly, because this is faith-based, I can talk about this, that we seek the Lord definitely for healing every day. But it's also important. Also, I truly believe in therapy and some other things. Therapy is so important that Luke was a physician. And so we got to take note of that and take care of ourselves. And that's self-care. That's part of that self-care. but you ladies have done an incredible job. I have truly enjoyed being on this panel and enjoying everything. And I do want to say, I got to put this plug in because forgive me, but Saturday, August the 28th, if you know of anyone that is interested in becoming certified by the Human Trafficking Seminars, certified in the state of Michigan to teach human trafficking and to certify others for the state of Michigan. People need certification for jobs and different things. We're hosting, I'm not speaking, but we're hosting at 180 Church, 13660 Stansbury. We are hosting a human trafficking Train the Trainer event. And so it's an 8-hour conference. People will get trained in human trafficking, and they will be able to certify others and bring that information back to their village, because it's so important to be able to, and the numbers are growing. We have more kids that received laptops and hotspot devices in during the pandemic, and with that we have more people who normally didn't have that media, weren't on social media, but now that they've been given those devices and access to the internet, unfortunately, and it was for education, it was for a good thing, but unfortunately it opened up the door for Satan to come in and to get a lot of our, and trap a lot of our people, again, targeted, tricked, and traumatized. It opened up an opportunity for people to come in and to target our young people. And so our numbers went up during COVID. There's an uptick in numbers during COVID. And so we are hosting it Saturday, August the 28th, and I can leave my email in the comments, or Cara has my phone number if you need to get in touch with me if you're interested in attending this conference. Thank you.
Okay. We've got about 2 minutes left, and I think we lost our moderator. So, but I've enjoyed being here. I've enjoyed the information that was shared. I've enjoyed you ladies tremendously. There she is. She's back.
It wasn't letting me share for some reason when you guys were talking. But yes, thank you so much for all of you guys for sharing your information. Thank you so much, Pamela, for and Natalie and Stacey for all of your information that you added on as well. The app, by the way, is called Randonautica. I don't think it's as popular anymore. I'm gonna put the name of the app in the chat for anyone who wants to look into it more, because I know Stacey, you asked, and I believe someone else also asked. Randonautica. There are a few articles about the app, by the way, that talk about what it might be used for, but no one can really tell because it's fairly new and very suspicious, to be honest. Thank you, everybody who participated, and thank you so much for our panelists for sharing, as well as their own personal experience as well. And if they want to add on anything, last final remarks.
Well, I would like to say that I appreciate the opportunity to share on toxic relationships. That's one of the areas that I dove into early in my recovery, and in fact was the very first professional development training that I wrote, Toxic Relationships, Another Addiction. Is it love, or are you just thirsty? And now we've added, my daughter comes on and she trains with me, and we've added it as a gateway to substance abuse for adolescents. And so we talk about toxic relationships and adolescence, and the link to not only the link to drug abuse, but the link to drug abuse, as well as the link to sex trafficking and the link to prostitution. And so I put my website in the chat for anybody that's interested in trainings, provide training throughout the year, 2 trainings a month for those that need certification hours.
And thank you so much for sharing that extra information as well. I believe that after this session concludes, you all may go to the main stage as written in the chat. All right, and I think that concludes the end of our session on the impact of COVID-19 and toxic relationships. Thank you again one more time for all the panelists, and thank you for the participants for participating. Thank you so much, and have a great rest of your day.
All right, thank you.
Bye-bye.
Weekend.
Yeah. Thank you, everybody.
Have a great weekend.
Yeah, thank you very much.
Bye.
Goodbye.